So to get started, I'd like to introduce you to our speaker today, Nick Altebrando, who's the VP of Product Strategy at AbleTo. Nick is a veteran product leader in health and wellness with over 20 years of experience building software products. He's led teams at Medscape, WebMD, and is currently leading product strategy at AbleTo, a company that focuses on telehealth for accessibility to mental health services, where we worked together this year. So super excited to talk to you this morning, Nick, and hear how the landscape is rapidly shifting for telehealth. Welcome.
Great. Glad to be here. Great to see you, Ellie.
Yeah, great to see you too. We'll jump right in. So can you share a little bit about the backstory of AbleTo and how it got started and where you are now?
Sure. So AbleTo, I've been at AbleTo about 2 years. Almost, I'm checking the date. It's about a week and a half before 2 years. AbleTo has been around though for more than a decade. So its startup status is starting to wear off, I think. And it was founded on the basis that first of all that mental health and behavioral health were as important and deeply interconnected with physical health. And also that a protocolized approach to treatment, in the same way that there's protocolized approaches to medical treatments, strongly evidence-based and measured, can be an approach of that sort can be taken to behavioral health. And their products are really kind of deeply distinguished by this protocolized approach, where based on the condition that AbleTo is treating, there's lots of flexibility and there's lots of customization, but there's also a pathway that the therapists are following that's measured and adjusted based on population data from the volumes of people that we treat. And that's the approach that it was founded with. Around 2 years ago, about the time when I came in, there was a little bit of a shift away from people who are what we call complexly comorbid with medical conditions, and an intentional shift towards people who just need behavioral health care. And the approach was the approach worked so well that the theory was, if we can take this approach not just for people who are sick in other ways, but who need primarily behavioral health care, and then it should work equally well. And we're in the course of executing on that strategy right now, and that's very much where Carbon 5 came in and helped us along with some of the technical work there.
Awesome. Yeah, I remember when we started and learning a little bit about AbleTo and a shift to treat more folks with mental health needs, behavioral health needs, that we interviewed some folks, and it sounded like before even the pandemic hit, there was a huge need for telehealth for this kind of work. Anyway, I thought that was really interesting. And does it seem to you that there was an unmet need for people that either live rurally or like couldn't make it to a doctor's office during 9 to 5 hours?
Yeah, it's funny. I probably over-described what we do historically and didn't mention that it's virtual.
Yeah.
AbleTo is a virtual telehealth provider of behavioral health, mental health services. We treat people with people. There's digital components, but it's largely human-driven, and it is through phone, audio, video. Yeah, so the two major reasons for therapy specifically to be done virtually versus in person is, one is there's a massive access problem in the country, where there are, I think it's close to 50% of counties in the country do not have enough licensed therapists to treat the population of that county. It's really concentrated around major cities. And so there's just a geographical and access problem. And another major issue is ongoing stigma, where people really just don't, it's hard to bring themselves to, the physical act of going for help is hard. And when you can do it from the comfort of your home, from a private environment, it reduces the barrier. And then obviously there's also just simple conveniences. You don't have to commute to your mobile phone for your visit.
That's a good point. And one other thing I was impressed about AbleTo is that if you're meeting with a therapist for like a full therapy session, it's not like an app that that could get you there, but you don't actually have access to someone that's like a therapist. It's kind of neat.
Yes, it's true.
But so you're already doing telehealth, but can you tell us a little bit about what the experience as a product leader was like when the pandemic hit and even more people wanted to access to telehealth?
Yes. Well, first of all, our service numbers are really booming. Without selling more services to more companies, our volume is significantly up because, in large part, I think because people have time to take some time from themselves and to enter programs like the ones that we offer. So we are experiencing some scaling. I won't call them struggles, challenges. We're experiencing some scaling challenges. We released a product that had been planned for around the end of the year, 9 months early, because of the reaction to COVID, or our clients asking us for help. Obviously, it was trimmed down from its original scope in order for us to get it out that early. But we had to make some very quick adjustments to our roadmaps. There's a lot of disruption amongst our product and engineering staff. Not just adjusting to working from home, but adjusting to product changes and strategic changes that we needed to make to better support our customers and our patients.
Wow, yeah, it sounds like so everyone was shifting to work from home, also moving up a product deadline. How has your employees and just your team been impacted, and how is everyone coping?
Well, most of our engineering staff and also our clinical staff, most of them work from remotely anyway. So we were in a pretty good position in that regard. Our product staff, on the other hand, and our design staff, they work on site. We have a San Francisco office and a New York office, and that was a pretty major adjustment. A lot of the collaboration and the brainstorming and the problem solving that we did happened in the aisles of the office, and in conference rooms with whiteboards, and we didn't really have to have a structured process to kind of drive collaboration and to drive creative thinking. So that's all changed on a dime, and it's something we're still really adjusting to. You have to force time to collaborate versus just sort of doing it because you're all together physically.
Or do you have any tips that have worked for your design and product folks trying to collaborate together, or is it just kind of like the rest of us are doing?
I think we're probably about halfway there. So I would have more tips in a couple months, but the things that we found that work, we do unfortunately need to have more structured meetings to discuss sort of what are like status meetings. What are you working on this week? What's sort of like, I call them like weekly stand-ups. So like, what am I working on? What am I blocked on? What am I looking forward to getting done next week? Where we just didn't need to have it before because we knew, we saw, and now we need to schedule time and get in rooms and do that. Otherwise, there's a risk of a little bit of fracturing. That's probably that's kind of the latest thing we're instituting. I mean, other than that, it just there's just an awful lot of Zooming, and I think my time spent in structured meetings has gone up from about 2/3 to almost 100%, just because there's we have to over communicate. Everything has to be over communicated, and it's. I wish I had better tips. I wish I had better answers. I feel like we're really still figuring it out, but we're keeping the trains running. It's about the most positive thing I could say.
I can relate to that, over communicating, especially as the market's changing and people reacting to just how our world is changing right now. It seems like we would have to have a lot of meetings anyway around those changes and how we're responding. and we're remote. So I think I think that's probably most folks' experience right now, especially like moving a product launch up 9 months.
Yeah.
We looked over a survey of consumers post the pandemic, and let's see, it looked like 5% of people in the first week of April reported that they had done telehealth for the very first time for any kind of medical appointment. And I know that we were talking about it too. Like I had my first like primary care doctor Zoom just personally, and that was kind of wild. Do you? I know you've seen some increased demand. Do you think that this is short-lived, or do you think this is going to be, as you know, insurance companies are allowing reimbursements for Zoom and telehealth? Do you think this is going to be short-lived, or do you think that people are going to get used to this and just keep doing it?
I think we've passed a watershed moment. I think well, first of all, I've been working in and around telehealth, not directly in it until the last 2 years, but very close to it for about 7 years. And I had my first televisit appointment during the COVID crisis. Actually, I've had them before, but I had visits to test a service or to kind of secret shop something. I had my first real medical need telehealth visits and over the past 3 months. I think in large part, what we've seen is telehealth has been structured like urgent care. It was and teletherapy is different, but for like in medical care, it was, telehealth was you hit a button in an app and somebody I call a stranger doctor would get on the phone. You don't know who they are. You're never going to talk to them again. And they would help you with your urgent issue. But your doctors, if you needed to see them, would say, set up an appointment. And what's really shifted there is, I'm sure there's been more use of sort of that urgent care model, but what's really, really shifted is that almost every doctor in the country is now doing televisits with their own patients, and people are seeing their own doctors, or neurologists and oncologists and dermatologists and PCPs, and realizing that worked. It worked fine. It doesn't always work fine, of course. There's things that you need to do, a procedure or a lab test or draw blood. There's lots of reasons why it doesn't work, but an awful lot of the reasons people need to go to the doctor can be done over a video connection, or even the phone, or even email. I had a full-on dermatology appointment that I was billed for over email. We never spoke. So
Wow.
that was I don't think it's going back in the bottle. I think people are going to say, I didn't have to travel there. I didn't have to sit in a waiting room for 25 minutes. And it was quicker, and maybe it wasn't as social, but it works. It works really well. And I think doctors are proving it to themselves, and I think patients are proving it to themselves.
Yeah, that's hopefully this means more people will go to the doctor instead of putting it off for a month like
Yeah.
I want to do.
Yeah, especially follow-ups where it is usually a kind of a talk visit, and how many people don't go to follow-ups and have a chance of backsliding when follow-ups could be done in 10 minutes over the phone or 10 minutes over a video connection.
Yeah, that absolutely. I'm down. I'd love to do that more. Another thing we saw in the survey we looked at, aside from people doing brand new telehealth visits, is that 68% of the people surveyed, this was in early April, there was a consumer survey by PwC Health Research Institute. They said that they're seeing new benefits from their employer, and 8% have received new mental health or emotional support related benefits. And so I'm curious, I know that you work with companies, you work with like health insurers with AbleTo. I'm curious, folks that are part of leadership teams at companies, like how can they support their teams through benefits like this for mental health and emotional support?
Yeah, we've definitely seen that from our end too. It's one of the reasons we released a product 9 months early, is from employer and insurer demand. So there are, first of all, there's lots and lots of evidence showing that's a technical term, lots of evidence. There's lots of evidence showing a really direct connection between the mental well-being of a workforce and productivity and low absenteeism. So it's always been important. It's increasingly become, it's started surveying near the top of lots of employers' lists over the past several years in new ways. And in a crisis like this, obviously it becomes doubly so. There are really good, there's lots of really great options out there. AbleTo and Enjoyable, Enjoyable is a company we acquired about a year and a half ago, and that's very much the foundation of our new initiatives to treat a broader range of people that are really evidence-based and focused on helping people in ways that work for them. There's lots of other companies out there too that offer something similar. We typically sell through insurance plans. We don't sell a lot directly to employers because so our part of our core model is we bill through insurance plans. We don't. It's not a separate service typically, and if so companies could go through their their benefits provider and find good options that way. And of course, there's lots of standalone services that sell directly to employers. I would certainly want to just flag that there's also lots of services that kind of, I don't want to say masquerade. They refer to themselves as mental health services, but they're really sort of wellness products. They're not necessarily evidence-based. They're not therapy. And I think you need to become a bit of an expert buyer to make sure you're buying something that makes sense for your workforce.
Oh, that's a good point. Yeah, like what is like we talk a lot about evidence-based therapy and AbleTo, and that was new to me because I had never worked in mental health. But yeah, so it sounds like if you're looking for a solution, evidence-based, like licensed therapists are great, and just doing kind of your homework if it's a kind of a wellness tool that's not necessarily therapy. Does that make sense?
I'm certainly not going to point fingers at particular products. There's benefits to lots of different products that even don't have necessarily evidence that aren't evidence-based to some people. But if you're an employer and you're looking to know and understand what value you're going to get out of a service you're paying for, I would certainly suggest an evidence-based approach.
Love it. And I'm wondering, so you have people even before this health crisis that were using your products at Enjoyable and AbleTo, and I'm curious if you've seen any drastically different in your digital products.
Well, the main difference that we are seeing increased levels of stress and anxiety, and we are seeing a higher percentage of people who are kind of completing onboarding and entering into treatment. It's a little bit hard to tell if it's because of increased symptoms or if it's because people have more time. There's definitely people are home more and they have a little bit more time. Their commuting time's taken away. Some of them are short hours, and there's people who just have more time to take care of themselves. So that's a behavior we've seen that's kind of starkly different, is that people have been more flexible, and people are going deeper into the programs that are what we call our adherence rates have been higher in terms of people finishing more of their sessions.
Oh, interesting. Yeah. So it could be that people have time, or it could be that people are experiencing more intense anxiety and depression. That's interesting. That is kind of a hard thing. Like you see a signal in your analytics and we don't always know why.
Yeah.
What are your thoughts about translating signals into reasons, especially like this is probably unprecedented because there's lots of changes in the world that's impacting everyone at the same time. So how do you suggest like digging in and figuring it out, or is it that important because things will continue to change?
We've had a lot of discussion about that. It's how important it is to understand the trends right now when they're hopefully temporary. Not that temporary, but they're things that we need to understand urgently right now. But if there's how important are these insights a year from now? I know it's a challenging question in general. I think I've typically drawn a little bit of a tactical approach where if you know how people behave, knowing why they're behaving that way is not always that important. It's frustrating maybe that you don't know what's driving behavior, but it's to me, it's always been more important to know how they'll behave and what people will do versus why. Uh, I tend to lean towards experimentation and real world evidence for user experience research, even for instance, versus more kind of, psychometric style analysis and kind of more upfront research. Although, I mean, both are very important, but where to me, where the rubber hits the road is what can you actually witness? What can you measure?
Yeah, what people do versus what they might say.
Think or say
Yeah,
they'll do. Yeah.
totally. We have a few questions that came in for Q&A. So folks that might have some questions that have come up during this chat, we still have a little bit more time if you want to submit those in Zoom and Q&A. And I'm going to go on and ask you at least a couple of them. Jessica wants to know that telehealth is on the rise. Now that telehealth is on the rise, is the market more competitive, or is it just a catch-up game for health and wellness companies right now?
I think that's a great question. There's I would probably say there's still a massive amount of growth that's going to happen, and I don't think I think there's lots of room for lots of competitors because of we're still in the very early stages, even though it's on the rise. I do think in terms of I think we're hitting an area where what's becoming more important that companies are able to scale rather than being able to just offering a service isn't enough. As it hits the real mainstream, the ability to scale flexibly is going to become the main competitive benefit.
Are we seeing lots of companies, or have you noticed companies that weren't in the telehealth space but were in the health and wellness space trying to catch up?
I have been seeing that for a long time.
Yeah.
even 7 years ago, there are companies, very, very large companies in the health and wellness space who are not in the telehealth space trying to enter it in various ways. And I think you see a lot of there's been a lot of false starts, and there's been a lot of not false starts where there's been real change introduced. I mean, even as an example, like the on-site telehealth clinics where you would go to a pharmacy and go in a booth and close the curtain and have a televisit with a professional. I think there's been 3 rounds of companies getting lots of funding and kind of going into that space, and each time it didn't work. But I think we could all see where it could, and I think eventually we'll see large retail corporations investing very heavily in models like that, and I think there will be a lot of different flavors that are successful. Some with the largest companies in healthcare, and some that are still good places for startups to enter.
Yeah, that's really insightful. And plus, you mentioned earlier that you're noticing since people are home they have more time, like they're not commuting, they're not taking kids to team practice and stuff like that. They seem to have more time and consider what they might do, and also they don't want to expose themselves unnecessarily. So it seems like maybe a more primed market than it might have been even 6 months ago for new services being offered by new or existing companies.
It is, and to me, there's a direct parallel between the there was a phrase that I used to hear a lot that like digital health. We'll know that digital health has really had an impact when people just call it health. That your digital connectivity tools and things that help you track your health are not that different from thermometers and stethoscopes. They're newer tools, but nobody has a special word for thermometers and stethoscopes. I think telehealth. I think we're going to see the same thing in telehealth, where you're not going to say, "I did a televisit with my dermatologist." You're going to say, went to the dermatologist, and it's, the fact that that was done over email or done over a video call, or by exchanging photographs, is not going to seem so unusual.
More fluid. That makes sense. Let's see. You were talking about how there are some therapy apps that aren't like based on evidence. Do you think the industry will become more regulated?
I think for the most part, I think it is regulated, and people are careful not to claim that they have evidence when they don't. But as a buyer, you make your own priorities. And if something is very slick and your employees love it, the fact that it has no evidence you might not care, and that might be okay, because it depends what it's really for, what objective it's serving for you. I have a personal bias towards evidence-based things. I think a lot of other people do, and there are, again, I don't want to call it masquerading, but there's lots of services that do have a section covering their evidence, and largely it's evidence that is amassed, in some instances, from other sources. So somebody will do a study on breathing techniques, and you'll have a breathing technique app, and they'll say, here's our evidence, and they'll link to something in PubMed or in the Lancet, and it's not their product that was being tested. It's a generic technique. And it doesn't mean that it doesn't work. It just means that their product hasn't been tested. And employers and wellness plans, they need to make their own judgments over their level of faith and in those generic services, and their level of trust, ability to kind of discern for themselves if something has true rigor, if they haven't done their own evidence-based peer-reviewed studies.
That's good insight for folks that are looking for tools for themselves or for their communities. Another question, David asked, what advice do you have for new founders, whether they're in the health and wellness space or not?
Oh, interesting. I'm going to answer definitely around the health and wellness space. The main advice I have for founders going into health and wellness is that health and wellness is a giant Rube Goldberg machine, and it's very, very it's complicated, and there are hidden incentives everywhere, and common sense doesn't always apply. So if you're going to enter the startup space and the health and wellness space, you could try to say, well, I'm going to disrupt all that, and maybe you will. Or you could really try to understand that Rube Goldberg machine and how it works, and try to carve out a place that simplifies a couple of those gears and can really get a foothold. And that does take, it doesn't necessarily take 20 years, but it does take some intensive research and such a real willingness to kind of understand the space. So in terms of non-healthcare, my philosophy around startups is and this is not that unique, is that almost every successful startup started with what could boil down to as a problem. When you're solving a problem, you are just removing friction for people, or just you're able to grow, and you're able to find a foothold. If it's hard for you to identify the problem that you're solving, you're probably going to be struggling. And again, I'm not the only person to ever say this, but I think it's even though it's probably common advice, I think it's kind of frequently under followed.
Excellent advice, especially with your myriad years of experience in health and health tech. I mean, it can be intimidating to new founders because it is quite regulated. And but yeah, I think that what you described about trying to simplify the Ruth Goldberg machine is really interesting. Thanks. All right, that's actually I think I hit most of our Q&A questions, and we're about at time. So Nick, I want to thank you so much for answering all of our questions.
Thank you. We'll see you soon.